Welcome to Season 1, Episode 15 of Torchbearers, the Valpo University Alumni Podcast. On today's episode, we talk with alumna Katelyn Donnelly, class of 2014, about her Valpo story and her project, COVID, Can I Do It? Stay tuned! Hello, fellow Valpo alumni, and welcome back to Torchbearers, the Valpo University Alumni Podcast. For those of you who are just joining in, welcome. My name is Michael Beaver, class of 2007, and I serve as your host for the podcast. I hope that you are all having a great week. I know it's been a hot one here in Valpo, and I'm so thankful this week for my central air. You know I keep asking this question, so here we go. How are you all doing? Make sure to let us know. We really do love hearing from you all. Today on the episode, we get to hear from Katelyn Donnelly, class of 2014. I don't know how Katelyn had any free time during her tenure at Valpo being a triple major, but she was able to do so much. Today we welcome to the podcast Katelyn Donnelly, class of 2014, who is a chemistry, international service, and humanities major, and is now currently working in public health, if I remember correctly.
Yes, yeah.
Awesome. So, Katelyn, welcome to the podcast. And why don't you start off by telling us a little bit about yourself and your Valpo story?
Yeah, so I am a 2014 graduate, as you mentioned, with that triple major, thanks to CC.
So you had plenty of time, right?
Oh, yeah. Very gracious professors is how I would phrase that, maybe.
There you go.
But so I also was in Christ College on top of that, and was a member of Kappa Delta sorority and had some opportunities to serve in leadership capacities there, as well as on the Panhellenic Executive Board. I also am a study abroad alum. I did two study abroads, one in Namibia for the semester program, and then the 2-week spring break experience through the College of Nursing to Latin America.
Very cool. Where in Latin America did you go that year?
We were in Costa Rica for the first week and then Nicaragua for the second week. Yes.
Very cool. Awesome.
Yeah. Then leading up to the conversation I think we'll have, I also was on the pre-med track.
Okay.
And some interesting things happened during my time at Valpo that started pushing me not away from that path, but towards public health.
Cool.
As you said, my current profession is in. So,
awesome.
Yeah.
Speaking of public health, let's talk a little bit about your position at the American Society of Plastic Surgeons. So what are you doing there?
So actually, I just left there. I was there for 3 years from June 2017 to June 2020. And then started this new position at Roswell Park Comprehensive Cancer Center here in Buffalo. They're the number 14 ranked cancer center in the country. So it's a very
fantastic, large
mission-oriented organization. And so I am a research associate in our cancer prevention and control unit. Our projects are fascinating, actually. Not to get into too many details, but they all center on this concept of chrono chemotherapy, which is using your circadian rhythm to figure out when is the best timing to deliver chemotherapies and other cancer regimens.
Interesting.
There's a lot of evidence out there that says the earlier in the morning you can do them, kind of when people just waking. It actually minimizes a lot of side effects, minimizes pain. It's more tolerated, but it's also more effective when delivered then.
Huh.
So that's one of my research projects there. It's very different than what I was doing at the American Society of Plastic Surgeons. But so to answer your first question, what I was doing there was writing clinical practice guidelines, which are evidence-based documents that help physicians decide best treatment plans given kind of comparative effectiveness of drugs or surgeries or treatments. And we also look at kind of the risk-benefit, the balance of risks and benefits for patients. So patients are included in kind of a comprehensive decision-making framework, which I eventually hope to get back into, I think.
Okay.
This move to Buffalo was definitely for personal reasons. Not that I don't love this job. I think both are fascinating, but as I guess we'll kind of talk about, my interest in public health messaging, I guess, and writing documents and that are understandable and usable by patients is something I'm really passionate about.
Awesome. So now, was the public health major available at Valpo when you were there? I'm trying to think and remember all of the
I
timing
know
on everything.
when the programs came to be.
Right.
Actually, no, it wasn't.
Okay.
I don't think the first MPH class started until 2016. Does that sound
Okay.
right? 2016 or
That sounds
2017?
Yeah, that sounds right. I was like,
Yeah.
I can't remember all the timing on that
Yeah.
one right away.
So I was one of those students that went straight to graduate school after
Sure.
undergraduate, um, which which was a good thing, I think, because it definitely shaped the career path that I have now.
Sure.
I had a fellowship overseas in graduate school in South Africa,
Oh, wow.
um, which I was well prepared for because of my experiences in Namibia and
Sure.
kind of studying the region. Um, but then through a series of events, found myself in the association world, which is for students and alumni listening, is very prevalent in the Chicago area, which is a thing I didn't really know. I wanted to be involved in the nonprofit side with public health, not necessarily in state or federal agencies. And almost every single medical specialty has an association in Chicago. The AMA is in Chicago, the American Medical
Hmm.
Association. The American College of Surgeons has an office in Chicago, and then almost every subspecialty you can think of. They also have
Oh, wow.
sister offices in DC that
Sure.
do a lot of the advocacy work.
FBC. Yep.
Yeah, but Chicago and DC are the two hubs for this kind of industry.
Oh,
So,
awesome. Very
yeah.
cool.
The other thing I was going to say is I was really interested in PA school before I went to
Okay.
Valpo. Um, I had actually looked at Butler's PA program,
Okay.
their accelerated one, and so I'm thrilled to hear that Valpo is expanding
Yeah.
into the PA and public health realm.
Hmm.
I think it just gives students who are interested in healthcare, maybe not medicine, or even maybe medicine, then they change their mind.
Sure.
So many more avenues. So
Hmm.
I'm thrilled as an alumni to see that those programs are
Fantastic.
getting strengthened.
Yeah, definitely. That's our College of Nursing and Health Professions is definitely one of the growing colleges at Valpo. So
Yeah.
it's always good. So, how did your experience at Valpo prepare you for what you had been doing at the American Society of Plastic Surgeons, but also in your current role now in cancer research?
Yeah. And I made a note of this, but I have to caveat before I say it that
Okay.
my chemistry professors will cringe when they hear me say
Uh
this.
oh.
But I don't necessarily feel I'm applying any of the technical skills that I learned in
Okay.
my chemistry program. However, with that being said, I am a researcher through and through in both the
Hmm.
position I have now and the position that I had at the ASPS. And throughout the entire degree program and across all the sciences, you're learning about the scientific method, how to formulate a hypothesis, how to synthesize and analyze data, how to gather evidence from trusted sources, and then be able to write technical reports about that so that they're transparent and repeatable and again trustworthy. So I definitely feel like that is a very strong set of skills that I have that I can credit Valpo for
For
instilling in
sure.
me. Yeah, and then really actually credit Christ College for a lot of the um, kind of questioning and thinking about hypotheses and being able to have dialogues back and forth with other researchers
Sure.
to find out where the gaps in the evidence are and what kind of future knowledge we need to or we need to be shepherding people towards. Um, and to some extent, I took specific coursework in Christ College and in my study abroad programs that illuminated this idea of what in public health we call the social determinants of health. Um, Ties into a lot of the Lutheran identity to Valpo of as Lutherans we think about justice and um, dignity in all people, right? And so
Right.
one of the major aspects of public health is thinking about what kind of structures are in place in our health system or just in people's lives that lead them to not be able to attain a level of health and wellness that other people can.
Sure.
And so that was a field I knew I wanted to pursue. I took a US healthcare course that was taught by Dr. Barrett Berry, who I'm not sure is at Valpo anymore, but that was through Christ College. And then I had the pleasure of being a student while Dr. John Nunez was
Okay.
teaching
Sure.
at the university. And he had a great course in humanitarianism that I took that got me thinking along these lines. And he was gracious enough to see that my interest through and through was in health, and all my projects centered on that.
It's always great when you have professors that can understand that. It's like, okay, now you can kind of get your research done that way.
Yeah.
So,
And then I guess that one other thing I will add that's not course related is that I credit Dr. Carolyn Whittier with kind of kicking my butt into gear in terms of thinking about not just like taking the steps to be a leader, but about what it means to actually lead people and do it with grace and make tough decisions, but also listen to people and listen to what they need.
for sure.
That is something I've taken into my career. I have this graduate degree, but I'm also often in rooms with people who I'm the least educated person in the room to some
Yep.
extent with all of these like physician scientists. So I think that being in that role helped me develop these skills where I do feel confident walking into a room and commanding the attention of people in these positions, which is kind of a great place to be. You know, all of these different skill sets I've built from Valpo.
Great. Great. So, Katelyn, walk us through your project of COVID Can I Do It and how it came into existence. What was the spark that led to the creation of the tool and kind of just what it is?
Yeah. So I was thinking about how to best present this idea. And I think I'm going to actually start with what the tool is in the first place.
Okay, sure.
And then kind of work backwards to what the spark was. So COVID Can I Do It is a digital tool. You can access it on your web browser. The website is actually www.covidcanidoit.com. It's also mobile friendly. So you can open it on your web browser on a phone, Android or iPhone is perfectly fine. And what the tool does is it allows people to learn about risks in the era of COVID that are inherent to things that they want to do in their daily life. So going to the grocery store, going to church, walking in the park, all of these different things,
Sure.
Traveling, commuting. We have a very extensive database of activities. But the point of the tool is to let people type something in, figure out what their risk is, whether it's low, medium, or critical,
Sure.
and then think through strategies to reduce those harms,
Okay.
or possibly choose a different activity that could give them the same level of engagement they were looking for before. It's pretty cool because it is also state specific.
Okay.
So somebody in New York, where I am, is going to have a very different score than, unfortunately, someone in Indiana
Yeah.
at the
Yep.
moment.
We've been learning.
And even, I know, and even worse in Illinois at the moment, actually, my hometown.
So it's dynamic then. So it's
It
ever
is, yeah.
changing.
Yeah, so
Awesome.
we have an algorithm that we have some brilliant software engineers who have built this algorithm with data from the CDC, data from several other reputable public health organizations that are trying to track the outbreak and different metrics around it. And so that changes daily based on if a state falls below certain thresholds or above certain thresholds.
Sure.
Another tool that's embedded in the tool is Google Maps data. So if I want to know specifically this Jewel Osco or this Wegmans or, name other grocery store, Stratton
Sure.
Until, that I want to go to, when is it going to be less crowded? What day of the week is that? And even down to what hour is that?
Oh, wow.
Yeah.
That's
so
awesome.
You can play with that, not just grocery stores, any destination that you're thinking of related to any activity. So it could be a local park even. And one caveat I want to make sure I mention actually before I get too far is we've discovered a bug this week
Oh no.
that some academic servers like to block the site. It's
Okay.
perfectly safe, but if students are having trouble, if they're on Valpo's Wi-Fi,
Sure.
maybe go to your mobile device.
Okay.
Yeah. Um, so to answer your question about actually what the spark was and how this came to be, I have a great friend from graduate school. Her name is Gayatri. She is a PhD fellow at the National Institutes of Health at the
Okay.
moment, and she's a virologist. So she works
Okay.
in infectious diseases like COVID. She and two of her other friends from growing up were getting inundated with questions about, you're a virologist. Can I do this? You also have a degree in epidemiology. Can I do that? And the theme of can I do this? Can I do this? Can I do this? Kept coming up. And so our co-founders, Jay, Gayatri, and Andrew, the three of them built a rough draft of this tool, wasn't dynamic at all, minimal amount of activities, and launched it in March.
Okay.
So at the beginning of all of this, they immediately knew that this was going to take off and that they needed to build a team. So Gayatri reached out to me through our connection at the University of Illinois, where we did our master's in epidemiology together. And I have been a member of the public health working group ever since around the end of April, beginning of May.
Okay.
So what my role specifically on the team is to take a look at the scientific literature that's out there, synthesize it into some kind of recommendation. This is
Okay.
the theme now that's coming in
Yep.
from my
Uh-huh.
work in guidelines.
Sure.
And then with another rater, come up with a scoring matrix essentially for
Gotcha.
this specific activity. And then that gets hosted on the site. So I'm one of the people in the background that's trying to synthesize all of the evidence that's out there for folks who may not be health literate to the
Okay.
extent that you would need to read academic journals, right?
Sure. Sure.
But we also try and provide some trusted neutral news sources.
Okay.
So things like NPR,
Mm-hmm.
Reuters, or the Associated Press to at least give people something that's digestible, from a very low health literacy standpoint, again, to understand what are the experts kind of saying about this? Like, here's a trusted voice that I'm
Sure.
reading about in this NPR article, and the tool's telling me the same thing. So we've tried to balance both of those perspectives.
Awesome.
What the tool actually looks at in the nitty gritty is ventilation. So whether you're
Okay.
indoors or outdoors, crowding, as I've previously mentioned,
Sure.
droplet production, which is, are you talking at a low volume, breathing normally, or are you singing and shouting and, spraying? Yeah,
Sure. Yep.
exactly.
Uh-huh.
And the fourth is time. So the length of time that you're exposed to any of these settings.
Okay.
So all of those four domains interact to give an overall risk score that a
Okay.
person would see. But they can also see individual harm reduction language for each of those domains.
Okay.
So the way we combat droplets is by wearing a mask. The way we combat ventilation is by trying to do activities in outdoor settings or in settings where
Mm-hmm.
windows are open and doors are open. So one of the things that I love the most about the tool and am most excited about, to bring this full circle,
Sure.
is how we are trying to educate people and give them tools that they can use in their daily life, and not being punitive about it, not telling them you absolutely should stop doing this, right?
Mm-hmm.
Certainly there are some activities that are much more risky than others, and
Sure.
people should likely consider stopping doing them. But the ideas of autonomy and dignity and justice keep coming back to me in this pandemic too. And even though, as a side note, I have a very personal stake in this, I thankfully have not had family members that are affected physically
Mm-hmm.
by the virus. But my husband and I have been married for a year, and he is stuck on the Canadian side of the border.
Oh, goodness.
So the border has been closed since March 21st. And as we speak, it's August 21st.
Sure. Yeah.
So, and it's going to be closed at least until September 21st. So my personal investment in this tool is giving people things that they can do to be citizen scientists, basically,
Okay.
and can, if they're afraid of getting the vaccine down the road, that's down the road. These are things they can do today to mitigate the transmission of this virus, and hopefully allow us to get back to some sense of normalcy where
Sure.
kids are, it's safe to go to maybe not concerts, but in
Right. Right.
social settings that we're currently limited from,
Mm-hmm.
right? And then of course the borders can open again.
Sure.
um, yeah. So
Fantastic.
I'm trying to think if there was anything else I wanted to specifically mention. I have loved being a part of this team. And I think one of the things I mentioned over email to either Stephanie or you
Sure.
was that it's all volunteer. We all have full-time jobs. Some of us are still pursuing our graduate degrees,
Okay.
but we would love to take on new volunteers as we grow. The tool is right now deployed in Uganda and the Philippines, as well
Oh,
as the US.
fantastic.
Yeah,
Okay.
and it is being translated into Spanish at the moment.
Okay.
And then I don't know if you can hear that. I live close to a hospital, so
It's all good. All good.
so sirens go by all the time.
I'm right
Um,
down the street from one of the ERs in Valpo, so I
oh,
totally understand that.
yeah. Um, so we're translating into Spanish at the moment, and it's going to be deployed in Argentina,
Okay.
India,
Okay.
Kenya, and Canada very soon.
Oh, nice.
So we
Very cool.
are expanding like crazy. And we had 13,000 unique hits to the site, with an average engagement of over 10 minutes within the
Oh,
first week of
wow.
launching.
Okay.
Mm-hmm. It is I think the top 5 cities we are in are Chicago, LA, San Francisco, New York, Houston, and
Okay.
then we have some random ones like Lowell, Massachusetts. A
Okay.
lot of people from Lowell love this tool.
Perfect.
But we are software developers, we are public health professionals, we are designers and the creative types in marketing and public
Sure.
relations. So we are looking for and happy to include anyone that has a passion for combating the virus, but also wants to build up their professional skill set in any of those areas. Um,
Fantastic.
yeah, and again, so we would welcome students or actually any alumni as well that might be listening
Cool.
who want to get
Awesome.
involved.
Awesome. So, moving on to a little bit different of a topic.
Yeah.
So, who are 3 people that have been the most influential to you?
This was a really tough one, I have to say.
Everyone has said that about this
Have they?
question. Yeah. Everyone's like,
Yeah.
I'm trying to think.
And actually, as I'm now staring at my bookshelf of all of my Christ College books that I have traveled with me through all of my moves, I still feel good about my choices, though, actually, after looking at my bookshelf. Um, so I guess the first person is Paul Farmer,
Okay.
who is the co-founder of Partners in Health, which is based out of Boston, Massachusetts. Um, we read actually a lot of his work significantly in some of the Christ College courses I was in.
Okay.
One of his anthologies is called A Partner to the Poor,
Okay.
and he is a medical professional. He's a physician by trade, but he also has become famous through this nonprofit that seeks to go into areas like Haiti after the earthquake. And he does a lot of extensive work in Rwanda, post-genocide Rwanda, to build up healthcare infrastructure and to do it in a way that's not only inclusive of people that are disenfranchised locally, but that uses their local resources and has this big mission of social justice in doing that and trying to reduce inequities in healthcare. They have a lot of programs in the US too. Uh, Valpo did a profile on me back in 2014, actually related to him,
Oh, okay.
because I got involved with his nonprofit and biked across the country after I
Okay.
graduated from college as a fundraiser for their organization.
Okay.
Um, so he's somebody I look up to, kind of being in this realm of public health and trying to think more critically about not just the delivery of care, but are we thinking about people's environments? Can they even breathe the air
Okay.
that's causing them this asthma because is it polluted? Or can they keep up with their medication regimen because are they even able to get transportation to come pick it up at the
Sure.
pharmacy? Or is it just cost prohibitive? So thinking about those different things in healthcare is something I've learned about from his biographies. The second person that I look up to and has been very influential in my life is actually a coworker from when I did my internship in Namibia as part of
Okay.
my study abroad. So her first name is Aletha. I did an internship at the AIDS Care Trust in Katatura, which is like the um, area of Windhoek in Namibia that during apartheid, the Black population was forcibly removed to, essentially.
Gotcha.
Um, she was like the most bubbly person that I like had known, and she was so welcoming. Spoke all of these local languages, Oshavambo and Herero. And I was only like the last couple of weeks of my internship that I found out she had been a victim of the healthcare system there. She had actually been forcibly sterilized while she was
Oh,
giving
wow.
birth. Yeah, she was HIV positive. And this massive lawsuit was actually going on unbeknownst to me this whole time. She was only one of several women suing the government essentially
Okay.
for doing this to them. And again, like the most humble, just soft-spoken person, you would never know that this kind of
Sure.
tragedy had happened to her. And I always kind of look at that silent strength that she had,
Mm-hmm.
and I was completely unaware of her life story and situation the entire time I was working with her, almost until the end. And that's something that whenever I felt like an injustice is occurring, or I'm really frustrated and don't know how to resolve a situation, her capability to be at peace and forgive, but also seek justice at the same time for what was done to her is something that I, on my best days, try and
Sure.
imitate. Right.
Mm-hmm.
So it's people like that who, again, just kind of an everyday person, not really someone that the history books
Right.
will probably write about, but has had a really strong influence on me. And the third person in a similar stretch is I am just in love with Greta Thunberg and Emma
Okay.
Gonzalez and all of these um, young people, which to me sounds crazy because I'm almost 30 and I still consider myself a young person, but these women are like teenagers, right?
Sure. Sure.
Or first year college students in Emma's case. So I just think it's actually incredible. Like we're in this nexus of just social change in every aspect: environmental
Sure.
justice, racial justice, healthcare changes, all of the above. And it's so cool to hear that some of the most vocal people are people below the age of 18 and people that haven't even started on their college experience
Sure.
yet, right?
Yeah.
That have so much knowledge and vast amounts of experience at the same time.
Mm-hmm.
And Valpo, I believe, is a school that takes those people in and just grows them exponentially at the same
For
time.
sure.
So I'm sure that there are many people who I have not named who are even current Valpo students who would fall into that category for me.
For
Just
sure.
influential young people.
Awesome. And then finally, what is one question and, of course, an answer that you wish that I had asked you today, but I haven't?
Yeah. Um, so this one again is a little personal, and I love Valpo, and I have tried to be a very engaged alumnus. Um, but I admittedly think that sometimes people really struggle after they leave a very nurturing place. And so
Mm-hmm.
one of the questions I was thinking about is, what is actually the biggest thing you struggled with after leaving Valpo?
Sure.
Um, Again, Valpo is an incredibly nurturing environment, but by the spring of 2017, at the end of my graduate program, I actually found myself in a clinical depression. I was diagnosed at
Mm-hmm.
that point and had days where I absolutely struggled to get out of bed. It was very difficult to talk to people. I think that I've been calling that my quarter life crisis because it happened right around the time I was about 24, 25. And talking with other Valpo alumni actually too, and sharing and opening up with this very personal story, I found out that a lot of us experience these kind of things around that same age. And we also feel really strongly that we don't want anybody else to feel those same things.
Right.
And so I think, maybe the answer to that question of not only what is the biggest thing you've struggled with, but what's the lesson learned there is I think mentorship as a young alumni is incredibly important to be involved in with current students and even students who are a year or two out of undergraduate. I think that watching friends get married and knowing I was still living with my parents at one point.
Sure.
But I also was in graduate school, and that's perfectly acceptable and cost effective, right? It's a smart financial decision. So I think sometimes students have this, 5-year plan, right, when they get out of school, and this is their goal. And if they don't achieve that goal, they're a failure for some reason. And so one of the things I would love to be further involved with at Valpo is just building networks of young alumni and mentoring current students, and not just with career advice, but letting them know that, it's a winding path for a lot of us to get to where we are. Infectious diseases was my passion, and I, from no doing of my own, have now found myself in this crazy environment where a tool like COVID Can I Do It is important. And that's it's not tied to my current employment. It's just a volunteer opportunity that I was able to be involved with, but only because I made those connections through graduate school as well. So you never know where the door is going to open or when it's going to open.
Right.
But I think that all the experiences culminate in getting you eventually to where you want to go. Or in my case, I thought I was going to be pre-med if you had asked me when I started in 2010. And the winding path through Valpo, through all of those experiences, led me into public health, adjacent to medicine, but something a little bit different.
Just a little bit different. Yeah.
Just a little bit different, but still so important and something I'm incredibly passionate about. So if we had this conversation back in 2010, I would have been a whole different person.
Wouldn't we all?
We would all.
Right. So, well, Katelyn, thanks so much for joining us on Torchbearers today, and have a great have a great weekend, because it is about that time. So,
and it is sunny and beautiful, and I think I'm gonna go for a bike ride this weekend.
Well, there you go. Well, fantastic. Once again, thank you, Katelyn, so much for being a part of Torchbearers and a guest on our show this week. It was wonderful getting to talk with you, and I'm excited to hear more about your project. If any of you out there are interested in being a guest on the podcast, make sure to let us know. Email us at alumni@valpo.edu. Again, that's alumni@valpo.edu. And we look forward to hearing from you. And make sure to check out our Homecoming at Home events that I know are going to be fantastic. For all of our alumni out there, stay well, stay healthy, stay safe, and go Valpo!